Since COVID, the number of patients that we see that are homeless has doubled. Those are the ones that we see in emergency. But there's tens of thousands of others in Edmonton that are couch surfing or are precariously housed. And unfortunately, with the weather right now, there's men and women out there that are developing frostbite as we speak. Doctors and nurses and social workers are going through great moral distress. There's nothing worse than seeing a patient in emergency, doing the best you can to help them, and then turning them right back onto the street again. And then not being surprised when they show up a couple of hours later by an ambulance all over again. There's a simple solution, and that's Bridge Healing.
We're not inventing the wheel here. It's housing with wraparound supports, healthcare aids. People aren't paying rent. We're just getting them out of the emergency department, and then we're sorting out the problems from there.
Our family was in the waiting room at the Royal Alec Hospital when Dr. Lou was treating Steve on one admission. He has had countless admissions to the hospital. And this is such a stressful time of the year for those on the street, but also their families. Like, it is excruciating when the weather turns cold as a mom to know my son is either very vulnerably housed or not housed at all.
And this must be, I don't know, let me just ask you the question plainly. Heartbreaking, maddening, frustrating when it seems like public discourse, around things like addiction, around things like mental health, around the unhoused population lacks grace, lacks empathy, lacks decency. Have you navigated that? Have you experienced that?
Absolutely. All along the 15-year journey that Steve had with serious mental illness and addiction, there has been so much misunderstanding and stigma and judgment. It's been kind of horrifying.
So what do you say to people? Or how have you managed that? I mean, have you made it almost in a way of honoring your son, or maybe part of your life's mission moving forward to change that conversation?
Yeah, I really appreciate the opportunity to tell Steve's story, because his story is so many people's stories. Mm-hmm. It's not that he's out there because he wants to be. He wasn't. It's not because he was out there because nobody loved him or cared about him, because he had a huge, loving, caring family. And I would love for there have to been a Bridge Healing in our neighborhood.
Every person has a unique story, and it might be a brain injury. It might be mental illness. No one is showing up without that unique story behind them and that humanity behind them. And that's what we're trying to do. Meet them as humans, give them some rest, let them lock their door, eat some food, shower. And then we're going to goal plan. Who are you and who do you want to be? But every single person shows up human, just like you and I. What's most innovative about Bridge Healing specifically is the direct referral from emergency department to housing. So when we have vacancy in our program, we let the 5 emergency departments in Edmonton know. And upon letting them know, we're usually getting a phone call immediately for someone to transfer into this space. And there's 2 barriers to access. Do you have a safe place to go right now? And do you want to be part of a housing program? And if the 2 answers to that are yes, you're coming over to Bridge Healing, you're meeting with my team, and we're moving forward in life together.
It's working. There's been over 440 patients go through these buildings so far. There's been a 40% reduction for those patients in returning to ERs. So those are those statistics.
40% is major.
Major.
Do you think it can be higher?
Absolutely, but we need more spaces. As Taylor said, the minute these spaces clear out, they are refilled. We all need our ERs. And if we can't walk in there and have care because there are lineups of 30, sometimes 40 patients a day who are houseless and technically don't really need to be in the ER, but they have nowhere else to go, that's a problem. And that's a problem we need to solve.
But the vision is ending this crisis we're in. People will enter into homelessness. If we can build a system that supports them to immediately exit homelessness, which we can do, that's the vision, Ryan, is that you and I have neighbors that have housing and can access housing within their chosen community that they can afford. And that's actually something we can do with mental health supports, with healthcare supports. It's not unfeasible. This organization recognizes that housing is healthcare. and that their hospital is being inundated with people who need to be housed. So the right thing to do to support all Albertans is to house these individuals. And I cannot give enough credit to the Royal Alex Hospital Foundation, their leadership and their board, to understand that if we give people housing as healthcare and we understand that, our whole community will change.